All right, we're going to get started. Welcome, everyone. Today's webinar is entitled Decriminalizing Sex Work in DC is a Racial Justice Issue. And for added clarification, when we're referring to we are referring to full decriminalization of sex work, which we will elaborate on. My name is Sean Bland. I'm a senior associate at the O'Neill Institute for National and Global Health Law, which is based at Georgetown Law Center here in Washington, DC. My co-presenters today are Benjamin Brooks, the Assistant Director of Policy at the Whitman-Walker Institute, and Tamika Spellman, Policy and Advocacy Director at the Sex Worker and Harm Reduction Advocacy Organization, HIPS, which is also based here in DC. I will let Ben and Tamika introduce themselves before they speak, but I just want to say that both have been partners of the O'Neill Institute for a few years now. I know the amazing work that they do, and I know how busy they are, so I'm so excited that they are able to join us today. I'm especially thankful to have Tamika with us. Tamika is someone with lived experience in sex work and works for an organization that every day is advocating for sex workers and working to meet their needs. It is so important to hear from sex workers, and our collective efforts are very much focused on centering the voices and the experiences of sex workers. Now, this webinar builds upon many years of work, both as part of a funded project, but also as part of the Sex Worker Advocates Coalition, or SWAC. Later in the webinar, we will go more into SWAC and continuing efforts, but I'm first going to just tell you a little bit more about the project that we've been working on. So I am the principal investigator for a project that is focused on improving laws and policies to protect sex workers and to promote health and well-being. It does not go without saying that this project is not just about me. It is very much so is a collaborative endeavor of our three organizations. And this is something that we've worked together very closely from the conception of the project through getting funding for the project, collecting and analyzing data, and then also finalizing and releasing a report. While Ben and I are the co-authors of the report, many more people made this possible. And HIP staff, including people with lived experience, contributed to and informed all the work that we engaged in, so all aspects of the project. The O'Neill Institute, the Whitman-Walker Institute, and HIPS had a report launch event on December 17th. And so that was when we officially released the report from this project. And I think that was a really great event that reached a lot of people. And it also received some press coverage, which I'm sure some of you saw. However, we knew that there was a need for a follow-up event, and particularly for two reasons. First, I think it is hard for folks to attend events around the holidays and at the end of the year. So we knew that some folks were probably not able to make it at that time. And so we wanted to have another opportunity to reach more people. And we did direct outreach prior to this event to specific groups, to racial justice groups, criminal justice groups, and social justice groups. I'm sure some of those folks are on the webinar now, which is exciting, but also to student groups and to young people across DC. So I'm hoping that there are some Georgetown Law and other Georgetown students who are also on the webinar today. Again, we know that the work doesn't stop with the releasing of a report. And so having this follow-up event and then also just learning about continuing advocacy efforts, including efforts that we'd love for all of you to find ways to plug into, I think is really critical. The second reason why we wanted to have this event was that we only had 1 hour for our report launch event, and that had a panel with more folks who all spoke. It was great to hear from them, but we wanted to just have more time to go into the report. And also just recognizing that not everybody has the time to read the entire report, which is over 50 pages. So you'll see the report in the kind of the chat box. So we'll share the report so you can still go to it after this event. But again, recognizing that everyone's not gonna have time to go through it all, we wanted to have this time to really go through all aspects of the report. So here is what we're going to be doing today. So I've just given you the welcome. Where we're going from here is just a little bit more introduction, some background on how we've worked together and the kind of the need for this type of work. And today, again, we're going to go through the report. And the report includes a lot of different information that we hope is very helpful for advocacy. We're going to be discussing sex work decriminalization as a racial justice issue. Given that nearly all the sex workers that we heard from in the focus groups that we conducted identified as Black, it is important to discuss race, and we want to make sure we center race in all of our discussions. We will also discuss the history of sex work criminalization and policing in DC. And so the combined discussion on race and history made us think that this is a webinar that would be really good to have during Black History Month. So again, focusing on the impacts on Black people and also thinking about the history of sex work criminalization. Lastly, we're going to discuss the major findings and the recommendations from the report before we have some time for questions. So again, we're going to have at least 15 or 20 minutes dedicated to questions at the end. So please use the chat box or the question and answer box to ask questions, and we will do our best to answer as many of those as we can. So our research explores how DC laws work and how they impact sex workers. I want to just state from the very beginning that we stand on the shoulders of those who came before us. Our work very much was informed by particularly two reports that we highlight here on this slide, the Move Along report by the Alliance for Safe and Diverse DC, and Access Denied by the DC Trans Coalition. So these reports just have a wealth of information. We'll be sharing some information from them as well, but they very much informed our work. We're not the first ones to work in this area. And so again, as we acknowledge the history and we kind of go through some of that history later on, these reports and lots of other work is really has been instrumental in us to kind of inform what we're doing now. In terms of our project, we focused on laws, policies, and practices. And we talk about laws, we're talking about laws specifically from the DC Council. We're talking about policies from the Metropolitan Police Department and just the practices, the policing practices of MPD officers. And in particular, this project seeks to identify how laws, policies, and practices affect the health and well-being of sex workers and the community at large. So why does this research matter? Well, we know from the transgender, the Access Denied survey, that DC's trans community has an HIV prevalence rate that is 8 times higher than the DC general population. That DC's community of sex workers have an HIV prevalence rate that is 17 times higher than the DC general population. And that particularly the trans community, so individuals from the trans community who engage in sex work have an HIV prevalence rate that is nearly 30 times higher than the DC population. And then on top of that, we think about specifically trans sex workers of color, particularly Black trans women. Those folks face multiple co-occurring social challenges. So not just including HIV, but also violence, criminalization, racism, and transphobia and other issues. So again, thinking about all of these co-occurring issues that are really rendering this population particularly vulnerable, and why we wanted to make sure that we focus on their needs and particularly the impact of criminalization on them. I also want to just point out nationally that it's estimated that the murder rate for trans women is more than 4 times higher than the murder rate for all women in the United States. So again, this is a particularly vulnerable population. And so now I really want to, that's like my introduction. So I want to pass it to Tamika to provide some additional opening remarks and to share give her own personal introduction. And then we'll delve further into the topics of the webinar. Tamika?
Good afternoon, everyone. My name is Tamika Spellman. I am the Policy and Advocacy Director for HIPS. I have 4 decades of sex work experience. I came into the decriminalization movement because I wanted to help every way I could to increase the health and the safety of sex workers. Many years as a street-based sex worker, I have a clear understanding of the violence that occurs and the systemic issues that keep sex workers separated from medical help, mental care, housing, employment. And my reason for coming into this fight is to change a lot of the systemic issues that we face and make it easier for us to survive and to thrive. You know, it is 2021, and it is absolutely ridiculous that we are still having these issues with HIV being so prevalent. This is a 30-something year fight that we have been in with this disease. And who better to help to mitigate those issues than people that are affected by it the most? My voice has weight behind it because I have survived this for decades. So, because of my experience and the knowledge that I have, I come into this fight to make sure that people understand the barriers that we face and what that number one barrier is, and that is criminalization. It makes absolutely no sense to bar people from being able to succeed, to bar people from access to healthcare. It's not fair because it also affects us in other areas that affect our healthcare. Housing affects people's healthcare. And when we are barred from housing because of arrest records, because we are sex workers, that leaves us in precarious health circumstances. And HIV still spreads. Through careful work with HIPS, who I've known since 1993, beginning as a sex worker, engaging with them, that helped me to understand safer sex practices. I too today work my ass off to make sure that people are adhering to safer sex practices. And it is easier for us to adhere to safer sex practices and to be connected to mental and health care if we have stability. Stability comes from not being criminalized. Stability comes from not having systemic barriers. And those systemic barriers are what I fight for. And that's why I'm here today.
Thank you so much, Tamika. We're, again, so excited to have you be part of this, and we'll hear from you throughout this presentation as well. I'm going to move on to our kind of first kind of major topic for the webinar, and very much a major topic of our report is that sex work law reform is a matter of racial justice. So I just want to start with some statistics, you know, kind of nationally, and then kind of zoom into DC, and then kind of think about the multiple ways in which race kind of intersect with the lives or with the experiences that sex workers face in terms of being policed and criminalized. So again, we have the 2015 US Transgender Survey, which found that 28% of Black transgender people reported engaging in sex work in the past. That's compared to 20% of all transgender individuals. So a significant number of Black trans individuals engage in sex work, and we see even higher rates among Black trans women. In DC, over 50% of Black and Hispanic transgender people have a history of sex work, compared to 12% of white transgender individuals. And nationally, we know that 13% of the US population is Black, yet 40% of adults and 60% of youth arrested for prostitution in 2015 were Black. Again, we see an overrepresentation of Black people in particular in the sex trade, and that those folks are bearing the brunt of criminalization, of policing, and convictions. We know that this is against the backdrop of over-policing of Black communities generally. And so this is some data from DC, where we know that 47% of DC's population is Black, yet Black people make up 70% of all police stops, 61% of stops that resulting in tickets, and 86% of non-ticket stops. So again, when we think about these issues, we need to be working towards not only decriminalization of sex work, but decriminalization writ large. We need to have things like the NEAR Act. We need to have alternatives to criminalization. We need to be investing in communities and services, all the things that Tamika, like, I mean, again, this is why we want to have her here, just so eloquently and quickly says, we write a 50-page report, but she just kind of gets down to the heart of it. We need to be supporting housing and employment, all of those services that are so critical for folks.
So can I interject real quick?
Yes.
I've been working on some facts and figures on the movement to defund MPD. And over 3 years, we can save $250 million by removing 1,800 officers. That's $250 million that we could be investing back into the people of the city. That's $250 million that can address homelessness, that can address the health disparities of people, that can address issues that the police have no effect on. Criminalization is not going to stop poverty. Supporting the people of this city will. Giving them a hand up instead of jailing folks is what we need. We need to look at decarcerating the system, which also involves decriminalizing the system. Stop criminalizing people's behaviors. Stop policing behavior and institute crisis intervention teams. Something that we're advocating for is to have people that come out to intervene in crisis instead of police. They're not going to solve the problem. They're going to put people in jail that are still going to have the same issues, problems, and concerns when they're released. That is not the approach that we should be taking. It is time for us to start investing in the people and not the police.
Absolutely, well said. Thank you so much, Tamika. And again, like this is, in terms of informing our report, we learned so much from, again, Tamika and sex workers with lived experience in terms of, again, not only the impacts, but in terms of the road forward, how we need to be thinking about not just, again, decriminalization of sex work, but all decarceration and defunding the police and how we can move money into the areas that are going to have the most impact. And so when we, again, developed our kind of focus groups, having folks from HIPS and having folks like Tamika kind of inform how we ask questions and things we're focusing on, invaluable. So again, when we think about race in terms of all of our work, policing and criminalization of sex work disproportionately subjects Black people to racial profiling, to police violence, and to mass incarceration. Black transgender women in particular are vulnerable, and our research is about centering their voices in that conversation about what are the policy and the legal reforms that we need to be enacting. As I mentioned, nearly all of the sex workers who participated in our study, 96% identified as Black, 2/3 of the participants in our study identified as transgender as well. And so again, we're going to be talking about race, I think, throughout our presentation, but we really just wanted to, again, lead with this in terms of our introduction to make sure that we're, one, living up to the title of this presentation, but also just the lived experience. And so now we're going to hand it over to Ben Brooks, who I think will work with Tamika to kind of lead us through some of the history of sex work criminalization and policing in DC, and then we'll get into some of the findings and the recommendations from our report.
Thank you so much, Sean. Can you advance the slide? Oh, perfect. Okay. Hi, everyone. My name is Benjamin Brooks. I use he, him pronouns, and I am the Assistant Director of Policy with Whitman-Walker Institute, excuse me. I am really honored to be here with Sean and Tamika, and it has been like such a beautiful joy to work with them on producing this report and to work with them on other issues in DC that are dear to our community. I am using this slide as my sort of introduction to my portion because I want to elaborate a little bit on the how we got here story of DC's own particular criminalization situation. It's interesting to look back on history, and I think we'll find as we explore it that history is repeating itself a little bit more on the nose than we would like it to be. And so hopefully we can take some lessons from the past and forge a new path forward. This slide is 2 pages from our report that form a brief timeline. And I am not going to go through each of these points, but I encourage you to check it out and read it. And if you're really interested, there's an appendix that goes into more detail on each of these items as well. Can you go to the next slide, Sean? So I want to highlight Washington, D.C. has had a very long and storied history with sex work. This is an amazing map from 1890s of listing 109 what were then called bawdy houses, or houses of prostitution, or brothels, depending on your favorite euphemism. And this sort of demonstrates that near the seat of power there have always been sex workers, and that there are other ways of addressing and imagining the way that we incorporate and involve sex workers in our communities. And so this map is really helpful to note just that the enforcement of the laws against sex workers have always been discriminatory, or at least discretionary. And so I'm going to move on to the next slide. One of the earliest forms of federal legislation around sex work or sex and morality is the Mann Act, which was passed in 1910, named after James Robert Mann, who was chairman of the House Committee on Foreign Commerce. This act is known colloquially as the White Slave Traffic Act, although it's race neutral. The reason it's called the White Slave Traffic Act is because it was coded into the law in the midst of a panic about the newfound freedoms that women were experiencing post-Civil War, the increased sort of mechanization of many industries allowed women to participate in the workforce more, and they were moving to cities in order to sort of engage in new forms of labor. And one of those forms of labor for many was probably sex work. But what we see is that there were politicians who were sort of ready and eager and willing to create fear about the scourge of human trafficking, creating unsubstantiated narratives around, I should say unsubstantiated racist narratives around trafficking rings, international trafficking rings run by cabals of Russian Jews and Chinese immigrants. This sort of feeds into very common racist tropes that were, continue to be common in some circles in our society today. One of the interesting things to note, that we will note repeatedly in this presentation, is that the laws were applied in a discriminatory fashion, right? This law in particular resulted in some pretty high-profile trials, including a trial against Jack Johnson, who was a boxer who was prosecuted under this act for traveling with his girlfriend. And in particular, another famous non-Black person, Charlie Chapman, who was a Jewish leftist, was prosecuted under the act as well. And so there are more examples of the discriminatory enforcement of this act, but it continues today to sort of be a part of the story of conflating the voluntary consensual work that sex workers do and the scourge of human trafficking, that although is a real problem, again, continues to erase the ability of people to address consent in this work. And so I want to move on, but I just also want to note that this fear-mongering and baseless narratives around trafficking are familiar to me in the conversations that we had around FOSTA SESTA and continue to have around the Earn It Act and other acts that attempt to use trafficking as an excuse to sort of quickly create a sense of emergency and pass legislation that has unintended consequences for vulnerable and marginalized people. Thank you, Sean. Next slide. So I'm moving us quickly to DC from 1910 to 1935. Congress was the legislative body that ruled DC, and they passed 3 laws in this year, in this 25-year span, sort of prohibiting pandering, which is another word for sex work, enjoining and abating houses of lewdness, assignation, or prostitution, which is another word for brothel, or just a place that sex work is done, and then prohibiting the solicitation for prostitution, which is a sort of role-neutral way, either that the buyer or the seller is prohibited for sort of even engaging in an offer for sex work. The reason this chart is here, I think it's particularly interesting to know, this chart is from a 2011 report by the Urban Institute based on census data, that at the time, and you can see the red line here is white, and I'm sorry, I need to zoom in on that. We've got here, the red line is white and the blue line is black. And so you can get a sense that the racial makeup of the city is changing drastically during this time. And it sort of makes sense that the legislators in Congress are responding to the change by trying to, I should be careful here because I don't want to impugn motive to people who I have no idea what their motives were, but it makes sense to address that the changing demographics resulted in changing laws. So
real quick.
Go, please.
Yes, so I look at this from a Black lens. And I look back at the time period that this is all happening. And we have to think back in those mindsets of then. And it's outrage that this is outrage of a proportion where Black people are starting to be criminalized for their freedom. You have to remember, emancipation has breeded a whole new way of using the slave patrols in a new form. And it was called policing. And because Black people had the gall and the audacity to go into sex work of their own accord and make money, people started being outraged at white men being solicited to by Black women, and it was not a white man or white woman profiting from it. It became moral outrage. People were all of a sudden up in arms about sex work, when this was something that had been has a very celebrated history in America. You can tell that by the amount of brothels that were here just after emancipation. And you can look at the laws and how they have proliferated after emancipation to control sex work.
Coming back. Thank you, Tamika. That's exactly what needed to be said. Thank you so much. Can we go to the next slide, Sean? So really rushing through a lot of history, but I wanted to bring us up from home rule, which was, I put in quotes there because we continue to lack a representative in our federal government. But from 1973, when we had home rule, which is the existence of the DC Council in pretty much its current state, to today, the DC Council has followed what I've identified to be really national trends. They're not in particular to DC, this sense that we needed to be tough on crime, that this sort of goes along with the war on drugs, that there's a sense both in Black and white communities, based on my understanding, that we needed to figure out how to create safety for everyone, and that there was a sense that police could be an answer to that question. And so there were instituted in Washington, D.C., things like prostitution-free zones, which were an arguably unconstitutionally vague sort of declaration that a police chief or a city government official could make that would allow the police to walk into a place and tell anybody that looked like they might be a sex worker based on the police officer's subjective judgment to please move along and leave the area. This is where the title of the Move Along report comes from. And we see in 1995, the city put up no right-hand turn signs after 9:30 p.m. in certain parts of the city in order to inhibit the ability of clients to find sex workers to have dates with, but through circling the block, which was a practice in certain parts of the city. The sort of more recent broken window policing, theories of sort of social control that we could reduce the levels of violence and increase the sense of prosperity by removing the visibility of crime from our communities, resulted in impounding vehicle law. So the police could impound the vehicle of a client if they were thought to be engaging in sex work. And the main function of the law from the legislative record that I've read was to embarrass clients so that they would have to sort of go home hat in hand to their families of some kind, and that the threat of embarrassment would sort of discourage them from engaging with sex workers. We see the rise of nuisance laws, which provide another layer of criminal punishment onto the very existence and work that's sex workers engage in. We see through criminalizing loitering for the purposes of prostitution that this just criminalizes existing in public space for sex workers. And then this is all sort of done in the time and the era where stop and frisk style policing is rampant, and police stops, which of course continue to be racially discriminatory today, are part of the handbook for removing from society people that the police think don't have a right to be there. I just want to emphasize again today that all of these laws are implemented with police discretion and therefore discrimination, right? Because the implicit bias is wired into our brains in a very tricky way, it's difficult for us to be objective and to provide reasonable answers to why somebody should be stopped. And so the police are caught with a law that is vague, and they have to try to engage with the public, and it results in harms to a great deal many people. One of the interesting examples, please advance the slide, one of the most interesting examples that I have found is this infamous march towards Virginia in 1989. This is an excellent example of the stop and frisk style policing. Early in the morning of July 26th, DC police conducted a forced march of sex workers down 14th Street. I think it's like 2 miles down 14th Street, across the 14th Street Bridge, almost to the Virginia state line. And I note almost here because a reporter walking home saw them and called a friend and a photographer to come down and take photos, which is why we have this amazing photo from Stephen Jaffe. And as soon as the reporters showed up, the police left and the sex workers just went on their way, because the police knew, I mean, apparently the police knew, because when they began to be photographed, they dispersed, that what they were doing was illegal. And so this is here to kind of note that for one, that the border created a moment of violence because the police were sort of apropos of nothing, decided to march sex workers down towards it, and that the opportunity for otherness that we see in the border is replicated in the system of race that we have. And so we're not, I want to take a moment here just to note that we're not solving the problem by removing sex workers from view, and that, as noted, sex workers are not a problem in our communities. They are part of our communities, and that we need to be doing everything that we can to create safety rather than enforcing a false sense of security for some and violence for others.
Let me interject a little bit in here also, so I can talk a little bit about the negative aspects of policing. Some of the things that I've experienced while I was out there in the streets. Like, instead of them arresting me, dragging me into an alley and raping me. After raping me, going in my purse and saying, I'm taking some lunch money. You'll be all right. You can make it back in half an hour. These are the types of things that I have had to deal with. When they talk about the move along, they weren't playing about that. If you didn't move along, you suffered a consequence. And that consequence didn't always mean you going to jail. That could have mean you getting your ass beat because they did that. That could mean you being raped because they did that. Or it could be you being extorted for money. To me, I felt like the police were trafficking me because officers seemed to know who I was. They knew they could come to me and get what they needed from me. They coerced me. So don't think that the police are all good all the time. They do things that are wrong. I mean, come on, just a couple of years back, they got caught soliciting sex workers. They videoed them. And this is nothing new. That sex worker had a lot more guts than I did because I would have probably panicked and did what they asked me to do because I don't like jail. And because they knew I had a healthy fear of being locked in behind bars, they took advantage of it. I remember a time when they used to criminalize us for having more than 3 condoms. That is a direct hit to public health. If you're out here and you don't have any condoms and you're just taking a chance, it's Russian roulette. The prostitution-free zones were an absolute joke because they were mobile. It was an officer's, oh, this is a prostitution-free zone, even if I'm not even prostituting that day. Excuse me, let me take that word back. Because it's not prostitution, it's sex work. It's a job. Believe me, it's a job. It was a job for me to have to duck and hide from the police so I wouldn't have these negative interactions with them. I have absolutely no trust for any officer, public or not. These are some of the negative things that happen because of the power that they hold over me.
Thank you, Ben and Tamika. Again, we're going to get more into what we heard from our focus groups, which I think really reflect the experiences that Tamika has as well in terms of rape, physical, sexual violence from police officers, just the feelings of disempowerment, and the fact that there is no recourse for a lot of, or at least a lot of people feel there's no recourse in response. So we will get more into that. We have a few questions that I'd love to be able to ask to both Ben and Tamika. The first one is to Tamika, but I think, Ben, you might also have some thoughts on it. So the question comes from Jill. So Tamika, Jill is wondering if there's a history of the racialization of sex work. And if there's not one, Jill says you should write it. And so I'm not saying that we need to like point anyone to a particular book, but I would love to just kind of think about that as like, I'm sure that you and so many other sex workers have experienced, have obviously very specific experiences as Black individuals engaging in sex work and racialization. What are some of your thoughts on that?
I think there's something similar to what you're talking about, and I think that was done by Reframe Justice. They have a timeline that they've done that kind of shows the history of criminalization of 2 different things that kind of were concurrent, and they all affected people of color in the most dramatic ways. And that is a sex work and drug use history timeline. So if you wanted something of that nature to have a clearer understanding of the timeline along the criminalization of sex work, look to Reframe Justice for that.
Great, thank you. And I'd also just add that, again, we've released our report, which we'll talk about, but we have some plans, hopefully, to develop a kind of a law review article, which would hopefully go a little bit more into some of the history of criminalization, some that Ben has mentioned, but particularly I think the importance of reflecting on racialization of sex workers is so key. So that's definitely something for us to have continued work on as well. We have another question from Joseph. Joseph says, the period from 1910 to 1935 was the height of Jim Crow, the KKK, and segregation. The economic suppression of women, Black, Indigenous, people of color, was part and parcel of white men maintaining economic and political control. Could you please comment on how sex work is the direct result of capitalist economic disenfranchisement of non-white, non-male persons?
Exactly. My point exactly. It is, this country was built on segregation. The Constitution even allowed for it, you know, and even criminalization is even built into this Constitution, where they can still enslave people through jailing them. We have to look at where we came from to exactly understand where we're at now and why. And it is systemic racism that is built in white patriarchy. It was never meant for us to thrive outside of being a slave. That was what we came here. We were trafficked here to be slaves, not to be free. And they have been trying to figure out better and more ways to ensnare us. This is how the prison system has become a slave industry. It's slave labor. They're still making profits off of people in prison. That is wrong. And it is all because of capitalism. Without money, you cannot survive. They do not want you to even farm on land unless it's approved to be farmed on. You can't grow your own garden in a lot of cities anymore. It has to be an approved garden. You have to pay to garden now. And this is because they would prefer you to go to the grocery store to pay somebody else for living. They kept us from buying property. We weren't eligible to buy property for years, but they gave property to white people that they stole from Native Americans. When it became opportunity for us to own property, we had to buy it. We were not allowed to be homesteaders. We couldn't stake a claim. The system was not designed for us to thrive. Why is it still that our numbers have not grown since 1973? It is because of the systemic racism, the systemic disenfranchisement of races. Why is it that we have not grown in wealth? Capitalism, systemic racism. The way this system is built to not allow us to thrive. That's where this comes from. It comes from the formation of this country and not having the forethought to change it when civil rights came into effect. It didn't go far enough. It only scratched the surface. The Constitution needs to be duly redone to ensure freedom for all, justice for all, equality for all. Women shouldn't have had to ask for the right to monitor their own damn body. Who the hell are men to tell a woman what to do with her body? We don't have a right to tell them what to do with theirs. They've been trying to control us from the gate, all the way back to biblical times. It's always been a man trying to control what a woman does and to try to control what other people do, instead of making sure that we can do everything we want, choose, and desire in the safest way possible.
Thank you so much, Tamika. I mean, absolutely. Again, this is why I think it's so important that we start with the history, and thank you, Ben, for leading us through that, and thank you, Tamika, for sharing so much. because again, this is a broader history. We could have had the whole webinar just be on the history portion. Obviously, we have some findings that we want to kind of get into, but the history in a summarized version obviously is reflected in our report as well. And this may be a topic we might want to kind of come back to as a future webinar, again, to think again from the founding of this country, from the Constitution through Jim Crow, through the continued kind of criminalization and regulation of women's bodies. All of these are topics that we need to be kind of really grappling with and working to continue to move towards actual liberation and freedom for folks. So thank you. We're going to move on to the next section because we don't want to have no time for the findings and recommendations. But we had one more question just for Tamika. Mostly a question because you had mentioned some of the illegal behavior from Metropolitan Police Department officers who violated you, who raped you, who all of those experiences. Were those reported to the MPD? And if they were those officers identified and punished? I think that's like a really critical question. So
no, I talk about it. I don't want to revisit that. I've dealt with that part of my life. What I want to do is take that power away from them so they cannot do it again. And then we need to also be looking at, when we're defunding the police, that we're also reforming their behavior. They need to have a uniform code of conduct. For anyone that feels like they should have a Bill of Rights that gives them the right to go out here and with impunity to do harm to the people that they're supposed to be watching over, is not right. I don't want retribution. I want change going forward.
Great, thank you so much. And again, we're going to get into some more findings around similar experiences of harassment and violence that sex workers have experienced at the hands of the police. What we heard was that many sex workers just don't report things to the police because they don't feel as if the police care about them, that there's nothing will be done, and that they might be subjected to actually more violence or harassment and kind of interacting with the law enforcement, interacting with the Office of Police Complaints. So this is a very important topic, and again, one that we delved into in a more depth in our focus groups. We have some more questions on history. I think I'm just going to move us forward. Hopefully we can get back to them kind of later on. Again, thank you, Tamika and Ben, for your presentations. Tamika, I'm going to actually bring you back because I'm forgetting that we wanted to make sure that we don't leave out some of the current organizing that's happening, particularly for Decrim Now and SWAC. If you would just for a few minutes just tell us about what's happened in terms of the campaign in the past and where we are kind of currently.
Okay, so the footwork behind this started in 2015. They started building the coalition and started talking with different legislators locally, started building power, and they had the first bill introduced in 2017. It didn't move. So we took it back, freshened it up, brought it back, but we still did a lot of building in between. That's when I came into the campaign, was at the tail end of it not moving in 2017. And my big mouth, running back and forth up there to city council, talking to them, talking with different constituents throughout the city, working with sex workers on the street, talking to different neighborhoods that sex work strips are in, trying to smooth things over with people, talk to them and let them see that sex work doesn't have to be a whole life, that all of us don't want this for life, but we need to get free from the system first in order to move forward. That criminalizing us is not working. I mean, even the last police chief said so. You cannot criminalize people to death with this. It's not working. So building on relationships was critical to this movement, getting to the point where we actually got the hearing after the introduction. And the hearing came so swiftly, I think we were a little bit overwhelmed, and it even though we had really strong local support, outside entities took precedent over this local movement. Our council was scared by big box people from New York, Seattle, Los Angeles, talking about trafficking and bringing in the idea of a partial decriminalization model, something that, number one, y'all didn't even bring anything to the table but your stories. And you all are recanting someone else's story. Well, we had the bulk of the people testifying in favor of this, telling their life story. I poured my soul out for this movement. I put my whole life out there for people to understand so that they would understand why I pushed so hard for this change. This change is not just about Tamika. This is about the people that have to come in behind me, because they're not going to stop. Sex work is never going to stop. It's biblical, child. Come on now. And then we need to stop looking at criminalizing people for living, for surviving. We need to start moving towards a society that makes my life safe for me to live. Because as a Black transgender woman, I have a lot of barriers still to deal with in 2021. And it's not fair. And it's not fair as a sex worker. I have an additional barrier to surviving and thriving. Just because it's a physical job that requires sex is no different than any other physical job, like a boxer or somebody that play hockey. They get hurt in their jobs, teeth knocked out, bruised, badgered, and boogered up. But y'all won't help me to stop somebody from robbing my ass while I'm out there on the street, or the police to harass me and rape me. Come on now, what are we looking at? This is a job safety. That's why we fight for this. Stop criminalizing casual sex, because it's all it really is.
Thank you, Tamika. So we have a quick question from Adam. Is there currently a bill pending in the DC Council that advocates for decriminalization of sex work? If not, kind of what's the current status? And have you drafted the language, discussed with any council members?
We're still pushing the bill as is. It is not currently on the docket. We're just asking them to bring it back up for a vote. We may reintroduce it at some point, but Tamika cannot continue on being the lead on SWAC. We are currently looking for a SWAC manager, because my advocacy role has grown. I have 1,000 other things that I need to be working on that I cannot dedicate all of my time to just the sex work movement. You know, we need to be working on getting drugs decriminalized. We need to be working on stopping them from criminalizing people for loitering, for public intoxication. I'm working on trying to decriminalize people's bodies for their behaviors. And I need to move us forward in some of these movements outside of decrim, because these are side issues that could also put you back in the path of the police to criminalize you. If we're taking away these laws, we don't need these police. I'm working on defunding the police. We got to take them away. And then after we get rid of the 1,800 cops, then we can work on the reform. But you got to bust down their contracts. We have to be able to get their contracts to take out those things that give them so much damn impunity from legal prosecution. These are people that can take someone's life, but we can't prosecute them when they do it wrong. That's not right. And we have to do more than just decriminalizing sex work. That's just part of where I'm going in my work. And not saying that this is not important, but it is still on the table. And it will advance, hopefully, before the end of this year. Because in all honesty, America's on that track anyway. It is already on that track to happen. We will have decrim in DC. It will be full decrim. It's not going to be the Nordic model. It is not going to be a partial decriminalization. That is absolutely ridiculous. It doesn't work. It has been proven not to work. It still harms the sex worker. And if we're talking about truly removing these penalties and stopping harm, we have to do what the sex workers have been asking for, and that is to let us go, let us free. Stop criminalizing me and stop criminalizing the people that are supporting me. That's like saying weed is legal, but don't get caught buying it. Does that make any sense? It's like saying alcohol is legal, but you bet not buy none.
Thank you so much, Tamika. And I think you actually answered another question about full decriminalization versus partial decrim in terms of would full decriminalization protect sex workers? You definitely very much spoke to the fact that partial decriminalization would harm sex workers. And so that's why you, and again, based on our report, we're recommending full decriminalization of sex work.
Okay, so I think I may need to go a little bit further and let people get an understanding of why not legalization as well.
Tamika, can we get back to that a little bit later once we've gotten into some of the, because that'll be in some of the future
because
slides.
we probably still got a lot to go.
Yeah, we have a few more slides, but thank you so much. And I just also want to just say, like, again, all this work can't be done by Tamika, nor can it be done only by SWAC. So Ben and myself are members of the Sex Worker Advocates Coalition. We need more people to be a part of this movement to, again, not just working towards sex work decrim, but decriminalization, decarceration writ large, all of the defunding the police. And we know folks are working on it. And I think this type of a webinar is, again, is one way to kind of bring folks who are working already on these issues from different ways together. So we're hoping that we can continue to brainstorm about how we can kind of continue to grow this movement. And particularly we need local voices to be behind it. So thank you so much, everyone, for your questions. Again, there's been growing consensus towards decriminalization. A number of organizations, including Amnesty International, and all these other organizations listed on the slide now have come out to support decriminalization to promote community safety and human rights. We've also had a number of international health organizations, the World Health Organization, AIDS, UNAIDS, the UN Special Rapporteur on the Right to Health, have argued against criminalization of sex work because it stigmatizes sex work, and they support decriminalization to improve health. We've also seen Black Lives Matter come out in favor of decriminalization of sex work, recognizing that criminalization is discriminatory against Black people, Indigenous people, and other people of color. So again, there is a growing consensus towards decriminalization. And again, we're gonna continue to emphasize that that's full decriminalization of sex work, which we'll spell out a little bit more in the presentation. Again, we released our report. Please check it out. This is from the O'Neill Institute, Whitman-Walker, and HIPS. It was funded by the Elton John AIDS Foundation. And now we're just gonna go through some of the key findings of that report. We did focus groups, 3 focus groups with a total of 27 sex workers. Here's some basic demographics of who we spoke to. So people between the ages of 20 and 55. Again, disproportionate, 2/3 of whom were trans women. About 30% were cisgender gay and bisexual men. Disproportionately, nearly all of them identified as Black. This was an extremely vulnerable population. 70% experienced housing instability. That said, folks reported having good health and also access to healthcare. And nearly 60% reported living with HIV. And so when we talk about HIV, which again, my work is largely focused on HIV, we need to be meeting those needs as well. In addition to the focus groups, we also did one-on-one interviews or individuals with interviews with institutional stakeholders. Those included lawyers, lawmakers, representatives from the Department of Health, representatives from the Metropolitan Police Department, from the Office of Police Complaints, as well as speaking to anti-trafficking advocates and other advocates, including the DC ACLU. These are the kind of themes from the focus groups, and I'm just gonna go through, we have slides on each of them. First, around motivations and reasons for engaging in sex work. Really, the main reason is to make a living for yourself, to earn money. So all the participants, but one specifically mentioned the need for money. So again, this is a socioeconomically disadvantaged population just needing to have money to take care of oneself. We also talked a lot with sex workers about substance use, which was tied to motivations for engaging in sex work. Participants discussed their struggles with substance use and addiction, suggesting that some sex workers could benefit from behavioral health services. Substance use was often thought of as a way of coping. So here's a quote: "I may have been at this time active in my drug addiction due to housing, due to stigma, due to all of this. I'm doing the only thing I know how to cope with." Other reasons beyond, again, those first ones that we just mentioned are access to housing, also access to food. So there's basic common needs. And it's really important to think about this in terms of the context. Social structural factors like your socioeconomic status, like housing and employment barriers, play a significant role in motivating sex workers. So again, just giving you a little bit more on the demographics. Almost 3/4 of the population were participants who lived below the poverty line. So that's earning less than $12,600 in 2017 when we conducted the focus groups. Again, lack of housing or unstable housing was very common for the folks in the study. Folks lacked access to education or to higher education. 59% had a high school diploma or GED or less. These folks experienced high levels of incarceration. So 85% had a history of incarceration, had spent some time in jail or prison. 53% earned all or most of their income from sex work. So we know folks engage in sex work in different ways. Some folks may occasionally engage in sex work to buy, to pay for a vacation or to pay for school books or some things like that. Some folks, again, get all of their income from sex work. And so most of the folks that we spoke to were getting most or all of their income from sex work. And 70% engage in sex work at least once a week. Again, housing and employment, Tamika emphasized this, but those are significant barriers that not only contribute to socioeconomic status, but those barriers are often tied to anti-trans discrimination. And so here's a quote: there are not a lot of LGBT people who are in a place to get an education to qualify for jobs like yours, but it goes back to housing and not having food and not having this or that, and not having this and not having that because you're not afforded it. And again, housing was such a critical issue, and we spotlight it very much in our report. Again, we need decrim, we need all the criminal justice reform, but we also need to be addressing all these other social determinants, and housing is a critical one. So another quote, we need housing. Without housing, we can't take our pills, we cannot make meetings, we cannot have stability. Without housing, everything's an uproar. And again, another quote, housing is very important. Once you got a house, then everything else will fall into place. So again, in addition to recommending full decriminalization, we make recommendations to expand affordable housing in the district with a focus on populations with the greatest need. Many folks talked about sex work as survival. Tamika did as well. Just in time, I won't go through all of it, but again, survival is how so many of the sex workers spoke about why they engage in sex work. So while participants struggled with poverty and having few options for work and housing, they repeatedly emphasized their own agency around sex work. And so when they talked about agency, often they mentioned survival and they didn't mention victimhood. So when we think about folks who are trying to conflate sex work and sex trafficking, that's not what we heard from the sex workers that we spoke to. They didn't use the word trafficking, they didn't use victimhood, they talked about survival. And again, survival meant different things to different people. Again, for some, it just meant covering basic necessities. But in others, there was a sense of power in their choice to engage in sex work. And I just want to give another quote because again, we want to emphasize the voices of sex workers. It's the second quote on the screen. I was very proud of, because I think that being a sex worker is very honorable because you're giving up yourself and you're getting money for it. You're giving services. This isn't violence. I'm working for people and I'm getting money and providing a service. Survival. It's an honorable job. It's a survival. It's for survival. Right? Again, folks talked about sex work as an occupation. And like any job, folks had differing opinions about it. Some people found it to be very easy and acceptable. Others said that, hey, it's a skill that they needed to kind of pick up and hone over time. So others found it difficult and they changed their attitude to it over time. So that's like any job that's out there, but thinking about, again, sex work as work. So we shouldn't be thinking about sex work as a crime, but as work. And as a lifestyle as well was another kind of way in which people kind of talked about sex work. While some participants would stop sex work if they had housing or a job or had some of these other basic needs met, others said they wouldn't. And again, just in the interest of time, I won't read the quotes for here, but again, they're all reflected in the report. In terms of experiences of engaging in sex work, we heard from street-based sex workers and internet-based sex workers, and there was also overlap between those folks. I think a major thing that we heard was that there are a lot of advantages to being able to do internet-based sex work. So be able to meet clients online, you're able to screen them. So you're hopefully less likely to have a client who's violent. You can also talk to other folks who might have had that same client and kind of just vet them to see if that's a person you feel comfortable meeting. you're also less likely to be subjected to policing. When you're on a sex work stroll, police are often there. You have interactions with police, where a lot of folks who only did internet-based sex work were able to avoid interactions with police. Again, we can't talk about internet-based sex work without thinking, though, about SESTA FOSTA and the implications of that. So that is something that's also reflected in the report in terms of how SESTA FOSTA has led to the shutting down of sites that sex workers use to find and vet clients or to screen clients. And so unless we address that federal law as well, so can't just be thinking about DC laws, we need to be thinking about federal laws, we're not going to be able to fully meet the needs of sex workers. There were lots of concerns about HIV and STIs. And for me, like as someone who works on HIV, I even asked, because I was on some of these, I was like, oh, is this really an issue for you? Is this like a big thing? Sex workers repeatedly said that this was a major concern for them. And again, I'm often surprised because I know it's important, but again, you have all these other concerns that you're dealing with, housing, et cetera. But HIV was a major concern. Folks did know their HIV status, and many those who were not living with HIV had an HIV test in the past year. Those were good things, but there were still major barriers that folks were facing. Participants had heard of pre-exposure prophylaxis or PrEP, which is a medication you can take to reduce your risk of acquiring HIV, but only 2 of the participants who were HIV negative ever reported using it. One of those persons was non-adherent, another one only used it after an accident, so they weren't using it as it was prescribed, and so it's not going to be effective as a preventive tool in the same way. And so there's a lot more work that needs to be done to educate and let folks know about PrEP.
Can I interject real quick?
Yes.
Let me interject something real quick about condom use and the ability to negotiate where you're doing your sex work at. That has been a problem with the Nordic model. This is one reason why sex workers are not happy with that model that in countries that model has been instituted in. That is why we do not want it here. So people have a very clear understanding that is a problem. I am not having sex without a condom unless I choose to. And my negotiation power on that is not negotiable. And that has become a huge issue throughout every country that has the Nordic model in place. Please be mindful of that. Do not take our ability to negotiate safe sex away.
Thank you so much for emphasizing that. And again, that we heard similar things around difficulties around negotiating condom usage. And again, and the evidence that's also reflected in our report is that the Nordic model doesn't improve that at all. And so this is why, again, we're emphasizing full decriminalization of sex work. 30% of our respondents reported that they disclosed to their healthcare providers that they engage in sex work. So again, most people didn't, and that's because of stigma, fear of discrimination. So again, those are issues that we need to be working on in terms of addressing stigma and bias among our healthcare providers and making our spaces safe for people who engage in sex work. Arrests lead to medication disruption. So here's a quote, every time you go through DC jail system, you already know what's about to be there. You ask for some medication and you don't have no medication. And so this is a very concerning finding. So even if you're just in jail for a day or 2, we know that it can just be very disruptive, not only generally for people's lives, but for being able to take your medication. So if you're living with HIV, you need to take a medication every day. If you're on PrEP, you take a medication every day. This can be a disruption for folks. And so it's important to see how criminalization impacts health. And again, tying it back to housing, there's a need for housing to store your medications and to be able to take them as prescribed. I just want to answer a few questions because I know we're going to probably run out of time. But question is, there were 25 respondents selected. How do you respond to questions about the small sample size? Again, this is a small study. When you do kind of qualitative research, you do focus groups. Usually you have focus groups of about 7 to 10 people. You don't really want to have more than that. It's just hard to have a good discussion. We did 3 focus groups because that was a manageable number for, again, starting off this research project. We hope to do more research and to continue to hear and learn from sex workers. We know HIPS has done research in the past as well, and that's all important to learn from. And our findings, I think, are comparable to past findings. But this was an opportunity, again, to write this in an official report, get this report out to all of you, to DC council members and to other stakeholders so that we can have this be part of the advocacy and part of the change. And so, again, it's a small number, but I don't think it's a number that it's so small when you think about the type of research, this kind of qualitative research where we learn so much from sex workers.
Yeah, I just want to add briefly to that, because that's exactly right. That the type of research that this is means that the limited sort of questions that we were asking called for doing interviews and focus groups until we reached like saturation, where people were repeating other people, and we had understood that we had captured the kind of range of information on the subject that we were asking about. So 27 participants over 3 focus groups is actually really standard for this kind of work.
Great, thank you so much, Ben. And it's, again, this is why you partner with folks who have MPHs and who can help you to develop this project. And so again, when we did this project, we had Jen Quate, who's a PhD who works at Whitman-Walker Institute and who helped us to, again, develop the kind of the research, how we do this in a rigorous way. And so we're really proud of the work that we did. So just in terms of other experiences while engaging in sex work, occupational violence, 56% reported experiencing physical or sexual abuse from clients in the past 2 years. That's the majority of folks. They also experienced violence from other parties, so the police, which we have several slides on that, because that was a major source of concern, as Tamika mentioned, as well as from strangers in the area. And so I'm just gonna read a few. A lot comes from sex work. You get beat up, you get robbed, you get cut. And then another quote, I was on blank street, and again, this is a DC street, so we took out the name, and some boys came out on the street with paint guns, and they were shooting girls on the stroll. So again, these aren't clients, these aren't police officers, but just bystanders who also are discriminating against and acting against sex workers. And again, all this violence has impacts on mental health. So it contributes to stigma, depression, drug and alcohol use. And I'm gonna skip the last slide, but that kind of summarizes that point as well. Our last quote. Health priorities, again, HIV was a major one, as was violence, but those weren't the only ones. We have a whole page kind of looking at the need for gender affirming care for trans individuals. Participants reported stigma and discrimination in accessing healthcare. Again, in terms of where we've seen some changes over time, there's some good things. We have health facilities like Whitman-Walker Health that are providing high quality healthcare to trans individuals. In the DC jail, transgender individuals reported being able to receive hormone therapy and treatment, and they were housed consistent with their gender identity. But even with that, there's still barriers and problems. I'm gonna give this quote. I was told by them that they can't take me because of me being transgender. They didn't have anything and the capability to fit my needs. That's just the stigma of being transgender. So again, repeated exposure to experiencing stigma, experiencing discrimination in healthcare. Encounters with the police. Nearly all participants talked about negative interactions with the DC police, although some, again, managed to avoid police interactions as a result of either luck or circumstance. So again, having housing, being able to engage in kind of internet-based sex work was a way for some folks to avoid the police. But again, what they experienced was a lot of harassment, violence, and abuse. And so when we talk about harassment, we're talking about misgendering of trans sex workers. We're talking about being asked invasive questions about anatomy, things like that. Just being demeaning towards sex workers. So when you're handing back an ID, doing it in such a way as if, this person is, has germs or is diseased in some way. And then also just experiencing profiling. So trans sex workers, particularly those who were Black trans sex workers in particular, experience being profiled as sex workers. So even if you weren't engaging in sex work, you were being profiled as a sex worker. And again, violence and abuse, and I want to give the next slide to show a number. 15% reported being a victim of physical or sexual abuse at the hands of the police in the past 2 years. When we did our focus groups, we heard lots of stories of abuse. We got this from our survey, but even outside of the past 2 years, there was even more experiences of abuse and harassment. I'll give you this quote. I got harassed by the police. They made me try to suck his dick for free, or I was going to be locked up on blank avenue. Again, that's in DC. We took out the name of the avenue. Many victims of this misconduct were transgender women of color, suggesting that some police officers may target this subgroup of sex workers who are particularly vulnerable. And again, so it's really important to think about race and the particular vulnerabilities of Black trans women in particular. Sexual encounters between police officers and sex workers, that's inappropriate, yet they're common. Sex workers are clients, and police officers are clients, and police officers are engaging in sting operations, even though what we hear from police is that, policing sex workers is supposed to not be a priority for them. And Ben will give a little bit more context on that as well. Again, there's widespread lack of trust in law enforcement. People were unwilling to call the police when they were victims of crimes, either victims at the hands of clients or at the hands of police officers because they feared arrest, again, because sex work is criminalized. They worried about being harassed, or they just didn't think the police would do anything. Quote here, you can't call the police about stuff because they're going to work you at the end. Another quote, when it comes to us calling or saying there was discrimination against us, calling us all types of he's and men, there's nothing. So again, nothing's done. Police participants voiced concerns about how police misconduct was handled, which again contributed to further undermine trust. And there was a need for cultural competency. Participants noted that there have been improvements in DC in terms of police interactions, but participants also said that there was a need for more sensitivity training and including racial bias training. I want to also spotlight, again, an area that I think there were some positive things being said about the Gay and Lesbian Liaison Unit, or the GLUE unit, also known as the LGBTA Liaison Unit. People did speak favorably about that. That's a dedicated unit of officers that focus on the public safety needs of the LGBTQ community. While participants preferred, again, the major preference for participants was to have no interactions at all with law enforcement. But where there were, if there had to be an interaction, they said, those who knew about the GLUE unit said that they wanted that unit to be called. And so I think that's a very significant finding to point out. And we include that in the report because I think there is something there. But again, we still think that even with the GLUE unit and the value that that unit is playing, decriminalization is still so important. And we heard from some sex workers that officers delay calling the GLUE unit or do not inform people about it. I'm going to skip this quote, but again, this is I think a positive interaction of where you have folks who are from your community who understand some of your needs, that they can respond in a different way than those who have, as the previous slide suggested, are engaging in harassment or abuse or other violence. Just negative impacts. I mean, Tamika's already said this, so I'm just going to very quickly just say there's so many negative impacts from arrest and incarceration, stress, loss of money, lack of housing and employment opportunities, obviously impacts for health as well. Most folks were being arrested for solicitation, but they're also being arrested for other things, including indecent exposure, sexual misconduct, and also drug crimes. And I think there was a real concern among a number of sex workers that increasingly the Metropolitan Police are going after them for drug crimes because they can keep them in jail for longer periods of time. And there's a quote here that, again, I won't have time to read, but it kind of reflects that concern. And again, please look at the rest of the report as well. We talked about different models. So right now we have criminalization. We want to move away from the criminalization approach. Again, sex workers prefer a full decriminalization model. So no longer criminalizing the buying of sex or the selling of sex. So sex workers aren't criminalized, nor are their clients, and nor are other third parties who are involved in the organization of sex work. That's different from the partial decrim model, which would only decriminalize the selling of sex, or decriminalizing the sex worker, but other parties could still be criminalized. And as Tamika mentioned, that doesn't make sex workers any safer. It still leads them to have interactions with law enforcement. And then another alternative is the legalization or regulatory model, as indicated on this slide, which I'll give you some data on, but that is a model where the sale of sex is legal in licensed models or in licensed brothels or in other spaces. And it's accompanied by, in many cases, other types of regulations. So whether it be mandatory condom usage, HIV and STI testing, registration, things like that. And you can see some of the countries that have these different approaches. Again, there's universal support among the sex workers that we consulted with, that the status quo is not okay, we need to reform. Strong support for decriminalization of sex work, and specifically strong support for full decriminalization of sex work, where the sex workers view that as better than partial decriminalization. And again, I won't go into some of this, but there are concerns about the spread of HIV and other STIs through sex work, and concerns about young people as a potential reason for why at least a few people thought maybe partial decrim could work. But on a whole, again, we found unanimous support, for, again, decriminalization for decriminalization, but specifically the vast majority of that support was for full decriminalization. And I'll give some quotes to support that as well. So I want to show that there's some diversity of opinions, but the vast majority of folks wanted full decriminalization. I'm going to say both. I don't think that the trick should be penalized for picking me up, and then I won't make money because you've scared him from coming back. I agree that it should be decriminalized on both ends because it is a mutual agreement between two parties. Tamika mentioned about legalization, and I'm hoping we'll have a little bit more time, and Ben might be able to speak to it as well, but I want to make sure that he has some time to kind of go through our individual interview data, and then also our recommendations.
Thanks, Sean. I'm gonna do my best to be brief. So the main point of the institutional interviews was that we found a lot of agreement on both sides of the issue, both the professional services of those who try to serve our community members and the sex workers as well. So what I want to sort of move us quickly, Sean, could you move us to slide 44? Just gonna drop all the way down. Again, all of this is in the report, and I wish that I could go through each slide in detail, but I want to make sure we have time for questions too. So this is a reflection on the policy and legal reforms section of the report. And so I want to highlight that those who support the partial decriminalization model in our work were more likely to express views that sex work is socially undesirable, meaning that it isn't good work. They believed that criminalizing buyers empowers sex workers to report abuse from buyers. What the research shows with regard to this issue is that criminalizing buyers drives buyers into a sort of more into the fringe. And what we're seeing there is that analysis of legal power ignores the other sources of power in the world, which is money, and ignores the fact that sex workers need the money that sex buyers have in order to survive. And so this analysis needs a little bit more of a closer look in order to sort of reach an equitable solution. Those who were in favor of the partial decriminalization model were more likely to equate sex trafficking with sex work. And there was a desire to monitor and regulate the sex trades, which really I think goes to the issue of legalization that I can speak to briefly here, that legalization of sex work is most commonly the model that is pointed to is in Nevada and in the counties outside of Las Vegas. And this model creates a bifurcation of a legal market and an illegal market. And so what we see is that replicates the issues that we see here, which is stigmatization, marginalization, criminalization of Black and brown, HIV positive, transgender women that replicate the current harms of our system and don't address those who are most marginalized. Those who support the decriminalization model believe that the laws are historically discriminatory against Black people. They view the laws as sources of violence for transgender women. They were more likely to support sex worker organizing and destigmatization. One of the central findings, which we'll go to on the next slide, but not quite yet, is that stigma is one of the primary harms of criminalization. And stigma is what drives people out of healthcare. Stigma is part of what contributes to unemployment. Stigma rends families apart. And so destigmatization, just the process of talking about sex work as work, is vital to the community engagement strategies that we have and vital to the culture change that we're trying to seek here. And then there's a sense for those who support the decriminalization model, I should be careful to clarify, these are not sex workers, these are service providers, that anti-trafficking efforts could be assisted by building trust between law enforcement. This is not something that many of the sex workers in the focus groups articulated, but it is an idea that those in the service provider space were articulating. Can you move to the next slide, Sean? So real fast, in just 1 minute, the DC laws, by criminalizing sex work, communicates stigmatizing messages about sex work, which are very harmful. They create vulnerability to violence and put a target on the back of sex workers and those stereotyped as sex workers. most often transgender women. DC laws and policies criminalize survival and homelessness. It criminalizes the very things that people are doing to try to stay alive, which are counter to public policy, of course. We found that the piecemeal solutions like vacatur statutes and diversion programs don't address the underlying situation that caused somebody to engage in sex work. And of course, they are often unavailable to the most marginalized groups who just don't have the resources or the sort of bright line survivor of victimization story, right? And again, it erases the capacity for consent that we see and really dehumanizes folks to try to force them into victimized narratives. And then that the MPD policies and practices are weakening accountability and undermining trust in the community. And so one of these particular policies is that the MPD's discretionary ability to disregard the Office of Police Complaints recommendations if and when police officers are conducting themselves poorly was really seen as negative for sex workers and service providers. And then that the individual discretion that officers have was sometimes a good thing and more often a bad thing. There were participants in our stakeholder interviews who spoke about knowing which police officer they needed to contact in order to get the result from the MPD that they were looking for. And that was a positive experience for them. But the discretion that police officers have in their enforcement, well, I think I've said enough about that. So I want to move to the next slide on our recommendations. So as you've already heard from us, our first recommendation is to decriminalize completely the sex work, commercial consensual sexual exchange. The second is to increase access to affordable housing. Again, we see housing is the #1 driver for people engaging in sex work. So we want to reduce the coercive economic conditions that make it easier for people to say no when they want to say no and to say yes when they need to say yes, which also means expanding resources for job training and other employment programs and strengthening the non-discrimination protections against LGBTQ people. So I think that's good on the findings. With all of our time, I want to make sure we have a couple minutes left to address any more questions that we want to address.
Thank you so much. And again, if we aren't able to get your questions, we hope to have future events as well. Feel free to email me if you have ideas or things that you'd love us to speak to or future webinars you think we can focus on, topics we can focus on for webinars. I want to get one question from Brett, who says, just acknowledging kind of the importance of kind of decriminalization of racial justice and not conflating sex work and trafficking. How should MPD, ANC commissioners, council members, and other officials respond when citizens who live and own businesses in DC demand that MPD respond to sex workers in their neighborhoods, claiming it negatively impacts their property values, business revenues, in some cases their health and safety? Did we include their voices in this study? And how do we address those concerns, and are those even legitimate concerns? I think, Tamika, you had some thoughts that you wanted to maybe share.
Hi, Brad. For you all that don't know who he is, he's a MPD officer. Okay, #1, your former boss already said that we cannot arrest our way out of this problem. So there's that. Stop calling MPD. We need to reduce the police force and institute social interaction squads or crisis intervention squads to deal with these kind of issues that policing cannot solve that issue. I think that has been very clear. As many decades as sex work has been criminalized, it has not stopped it. #2, these people need to understand what neighborhood that they have moved into. I mean, maybe the real estate agents should have been a little bit more forthcoming to the people that have moved into a gentrified city. Because a lot of these people did not know that they were moving into an area that was very well known for sex work. I mean, come on, the history of the district says that just past the White House were thousands of sex workers. Did you expect that to change because the city has changed? Obviously, it's not. We are here and we are not going to move. That answers that. dealing with us has to change. That's not acceptable to think that because people are having an issue about property values that are not changing. If anything, they are still rising. Come on now, Brett, they're not dropping. And where are these complaints now? I've fielded quite a few of them. I talked to people and I've gotten them to start being more active with the people that are in their neighborhood. I said just like this: if you're not safe, if you don't think that they're out there safe, then you ain't safe. This is your neighborhood too. Get out there and talk to these people. Have a conversation with them. And that's what I do. I go out there and I talk to them and I tell them sometimes the neighbors would like it if y'all weren't out here in the morning when they get ready to take their kids to school. Haven't heard that issue anymore because they call to hits. Someone that can actually reach out to these people and have a conversation with them instead of come down there and tell them to move along, or better yet, throw some cuffs on them and pull them in the alley and do what y'all do to them. It's time to shift that narrative. It hasn't worked. Let's try something different. And I still think 1,800 officers off of the beat is a better way to deal with this issue than having you there to criminalize people when we should have crisis intervention teams that can actually do something to help them. Does that answer your question?
Absolutely. Thank you so much. And I just want to get one last question. I know we're a minute over, but we had several questions just about how individuals can get involved in grassroots movements in DC. Will it be helpful to know how, they just asked, it would be helpful to know how and where in the process one can be most helpful. So if you guys just have your own thoughts on how folks can get involved, how they can be helpful in terms of advocating for sex workers, advocating for decrim, how we can continue to build this movement.
I'm going to echo what Tamika said. Decrimnow.org is a great place to start. There's a lot of information there. This is a question of culture change. And so talk to your neighbors, talk to your friends, talk to your mom and dad. It's a scary conversation to have, but if people engage with it and challenge their assumptions, then minds and hearts can be changed.
Thank you. And I'll say, just before I let Tamika have the final word, because I definitely want to end with her, that again, I think you can find our emails pretty easily. Feel free to reach out to us if you have questions about Decrim Now, about SWAC, about our research, finding ways to plug in with us. We're happy to be resources as well. And I want to have it end with Tamika.
I'll answer that last question from Jenny Kessler. Building on Cheryl Crawley's question, is there a step that can be taken now by the city to discipline and or educate MPD or create community responders while trying to decriminalize? That takes advocacy, because we know that they're not going to do it on their own accord. As much as I would like them to tackle this and not have us have to put so much input into it, they're not going to do it. So we are all working in coalitions to bring about change. That means reforming MPD, defunding MPD, decarcerating DC, and also to answer putting something in place instead of MPD. So those are things that are in the works for this year's session. People are going to be talking about it in all kind of budget advocacy going forward. There are a lot of budget advocacy conversations going on. Please sit in the room, even if you're not contributing to it, so you can hear what is being said, so that you can go back and retweet this and tag your council member into this, so that they understand I'm behind this. This is something that I support. Support the movements by being an active member in community and engaging your council members. Engage your ANCs. Tell them this is not the approach we want. We want decrim. We want reform. We want to reduce MPD. That's the way we're going to make this movement happen. Thank you, guys. Love you.
Thank you so much, Tamika. Thank you, Ben. And thank you all for joining us. I know we're about 5 minutes over. We appreciate all your time, and we look forward to continuing to work together on this issue, work together for sex worker rights and for sex worker and for full decriminalization of sex work in DC. Thank you. And that's the end of the webinar.